everybody, and welcome to the Blessed and Distressed Summit. We are so thrilled today. We have another wonderful guest, Dr. Ali Volpe. Dr. Ali Volpe is a board-certified Atlas Orthogonal doctor practicing in Durham, North Carolina. She is one of only 300 doctors in the world who practice Atlas Orthogonal Technique. And she studied under the inventor himself, Dr. Roy Sweet in Atlanta, Georgia. Is it Sweet or Sweat?
Sweat.
So I'm excited. I'm thrilled personally because Dr. Ali is my Atlas chiropractor, and I'm so excited for you to be here. Dr. Ali, welcome. And can you please tell our viewers a little bit more about yourself and how you ended up in this line of work?
Sure. Yeah. So I got into Atlas Orthogonal from a really personal connection that I had to it. My mom, unfortunately, was involved in what most would consider a pretty minor car accident. So she was sitting at a construction zone, person behind her didn't stop, smashed into the back of her. She had a trailer hitch on her car, so her car seemingly was okay and didn't take that much damage. They took her to the emergency room, took x-rays of her neck, nothing was broken, sent her home with whiplash. Couple months later, she got a frozen shoulder, so her body was starting to show symptoms. And then a couple months after that, she started to get debilitating migraines. And if you've ever had a migraine, you know how terrible it can be. And so she started with these migraines for an entire week that just never went away. My sister and I joked and said it was the never-ending headache. And then one day into this never-ending headache, she woke up and her eyes started to bulge out of her head. They literally bulged so far out of her head that the inner linings of her eyes slipped out, and it was just 2 eyeballs and fat pads. And that happened within one day. And from the start of the day to the end of the day, she also lost her vision. So she went completely blind, double vision, couldn't see. And she stayed that way for the next year. We went to different specialists after specialists. They couldn't figure out what was wrong with her. They thought that she might have Graves' disease, which causes the protrusion of the eyes. And they wanted to radiate her thyroid. Thankfully, we did not do that. But they couldn't find anything that was wrong with her. She was on a steroid prednisone for 250 milligrams a day for almost a year.
Oh my God.
On all of the different painkillers because she just was in excruciating pain. They finally diagnosed her with something called orbitopseudotumor, which basically means that there's a mass behind the eyes. They don't know what it is, but it is terminal. So I was in charge of calling all of our friends and family and saying, if you want to come see mom, now's the time. And one of our friends that came to see her was a massage therapist. And thankfully, she was rubbing her neck to give her a little bit of relief and said, your atlas bone feels really weird. And she described to her that her atlas bone is the top bone of your spine that the head sits on. And she said, I know this chiropractor that does this really different technique. He specializes in the atlas bone. You should just go see him. So we went in that day, life in her hands. She was crying. She's like, I'm going to die. Please save me. And this gentleman did something that no other doctor or provider of hers had done. And that was take an x-ray of her neck. Everyone was so concerned with her eyes and took MRIs, things like that. But no one looked down to the neck as the problem. And what he saw through specific radiographs is that that top bone of her spine actually was twisted 180 degrees on its axis. And it was completely blocking something called cerebrospinal fluid, which is the nutritional system of our brain and the cleansing system of our brain, from circulating throughout the brain and spinal cord. And it was pooling behind her eyes, causing them to protrude. So one adjustment, the next day, for the first time in over a year, she could see again. Within 6 weeks, she was off all of her drugs and driving again. And today we just celebrated this year her 63rd birthday. So she's happy and healthy and truly gave my mom her life back.
Wow.
Mm-hmm.
That is incredible. I was going to ask you before we get going to define Atlas, or what is that about the Atlas Orthogonal Technique? You kind of just started to do that. Yeah.
Yeah, so Atlas orthogonal, two big words broken down pretty easily. Atlas, like we said, is the first bone of your spine that your head sits on. Orthogonal means 90 degrees too. So we want your atlas sitting level with horizon, with your head sitting perfectly on top of it, creating a 90-degree angle with your shoulder.
Wow. Okay.
Gosh.
Yeah, quite a story.
It is. What a wonderful story, though, in the end.
Absolutely. Yes, everyone loves a happy ending.
Yes. So you've explained a little bit, but can you go into a little more detail about why that atlas bone is so important? Why you said it, it kind of blocked the cerebral fluid, but does it have any other importance other than making sure that it's sitting right so that that cerebral fluid can drain?
Yeah, so your atlas bone, like I said, is the top bone of your spine that your head sits on. It's a teeny tiny little bone that weighs 2 ounces, but the average human head weighs about 12 pounds. So relatively speaking, that whole structure, your head and your atlas bone, is like a bowling ball sitting on top of a donut. And the only thing that holds your head to your spine are muscles and ligaments. So by design, this area, what we call the upper cervical area, is pretty unstable because we give up stability in our neck for the amount of range of motion that we have. So when we have misalignment of this bone, because it's the first contact point of our spinal cord after it exits the brain goes from our brain to our brainstem to our spinal cord, and right as it exits the spine, the atlas bone is what surrounds it and protects it. So if there is a misalignment of that bone, it'll put direct pressure on that spinal cord and affect everything below it. If we think about it this way, if someone had an injury to their neck and they had a spinal cord injury to their neck, they would be paralyzed from the shoulders down, everywhere down. If they had an injury in their low back, then it would be from the legs down. So if we have a misalignment putting pressure on the spinal cord, it's affecting the whole systemic system everywhere down. And then it can also block the fluid that's circulating throughout the brain. It's really like the powerhouse or the circuit switchboard of the entire body.
Wow. So you mentioned misalignment, and an injury could cause a misalignment, obviously. Sure. How else would that misalignment, those misalignments occur?
Yeah, so we really boil it down into 3 topics: thoughts, traumas, and toxins, something that I refer to as the 3 T's. So basically that is physical stress, mental or emotional stress, and then pollutants, either externally or internal pollutants that cause that tissue to lose its integrity, making those bones slip out of place. So let's break that down here. So physical trauma could be a singular trauma, like what happened to my mom with a car accident. And even those low impact crashes where my patients come in and they say, well, I just got bumped, nothing really happened. Those sometimes can be even worse because when there's no damage to the vehicle, the force of that car is going somewhere, and it's typically to the occupant. So it can be a concussion or something like that, but then it could also be a repeated trauma over time. So this, or at the computer all the time, things like that. And then toxins are things in the air, so pollutants. If you live in a highly polluted area, your body has a limitation of its matter. So we can only metabolize so many toxins before it starts to affect our tissues of our body as well. It can also be things we ingest, so a terrible diet, eating poorly. You can't expect your muscles and your ligaments to function at their highest potential if you're not supplying the body with the nutrients that it needs.
Let's go and talk about what the atlas, if the atlas is misaligned, what does it do to the brain?
Sure. Absolutely. So when the atlas misaligns, it can misalign like a seesaw. Okay, so it can go up on the right or the left, kind of like this, with your head in the middle. So when the atlas misaligns, let's say it misaligns high on the left, low on the right, because whatever it does on one side, it does the opposite on the other side. And you have your head in the middle. What do you think happens to your head? So when the atlas misalign, the head tilts over. Now this makes the eyes unlevel with the horizon, but our bodies are brilliant and they can adapt really well. So when the eyes are not level, the brain says, okay, I got to do something to see straight ahead. So what you do is you pull a shoulder up to stabilize the head. And then because we have a cross crawl mechanism in our body, where we have that arm swing when we walk, is because your opposite hip stabilizes your opposite shoulder. So when head is tilted, shoulders come up, then the opposite side hip comes up, and it actually makes one leg shorter than the other. This distorts brain signals of where our body is in space back to our brain with every step that we take.
Wow.
And that is exactly what happened to me after my injury. I remember working with you, and this was off, this was up, my hip was off. Yeah,
absolutely.
All the way down the chain.
Yeah, another way that it can really affect the body and the brain specifically is not only can the atlas misalign like a seesaw, so up on the right or the left, but it can also rotate kind of forwards and backwards. So if it rotates forwards on one side, rotates backwards on the other, and vice versa. Really, it misaligns the ways that we can move our head, because that's the joint of our body that allows so much movement with our head. So when we not only have a misalignment component of what we call laterality, that's left to right, but we also have a rotational component. That rotational component is what gives that squeezing effect onto the spinal cord, and that's what really affects that cerebrospinal fluid flow. Now, cerebrospinal fluid, like I said, is the cleansing and the nutritional system of the brain, but it circulates throughout your brain and spinal cord with every beat of your heart. That's how it's pumped. So if you have constriction at some place in the spinal cord, not allowing that fluid to flow, it is going to be pulsating or backed up in the brain with every beat of the heart. Because of where the atlas is, if there's misalignment there, it will cause that cerebrospinal fluid to get backed up in the brain, and will actually put pressure on the most posterior or back aspect of the brain, which is called the limbic system. And the limbic system is what controls all of our emotions. So we can see things with atlas misalignment like anxiety, depression, even bipolar disorder that can be very much helped through atlas correction.
Wow. Mm-hmm. We just said wow at the same time.
It's amazing. That little bone has so much to do with your body.
Yeah. What are some symptoms of like lack of flow of that cerebral fluid?
Great question. So brain fog, chronic fatigue, headaches, neurological symptoms, numbness and tingling into the arms and hands, weakness into the extremities, so that's arms or legs. The list really goes on. Like I said, mental disorders, anxiety, depression, bipolar disorder. You can have asthma, trouble with your breathing because that affects everything below, remember, digestive issues. And when people have trauma to the neck, they can actually have associated with it what we call leaky gut syndrome. And that happens because when we have trauma to the neck, specifically like a concussion-like trauma, it causes all of our cells in our body to do what's called hyperpolarization. And that just basically means that they're all excited and they're all turned on at one time. And that in our gut, what that turns into is a hyperpermeability. Because when all of our cells get turned on, what we put into the system, everything just goes right out. So nutrients aren't being absorbed correctly. And so we can see digestive issues associated with that as well.
That's crazy.
Yeah.
It's crazy that such a small bone has such a huge impact on us.
It absolutely does. And the unfortunate thing is, I think that just so many people don't know that that could be the cause of their issue. Because let's say someone is struggling with headaches, or they have neck pain, mid back pain because of their shoulders off, low back pain because their hips are off. even knee problems because one leg is shorter than the other. If we just go in and we start adjusting where they have pain, let's say they just have low back pain, we go in and we start adjusting the low back, but that low back is really compensating for what's going on up here, that is just going to go right back to its misaligned state because that's the supportive structure for the shoulders and the head. So we look to the root cause of what's going on, and we really try and unlock that so that the head can come straight back on the body, shoulders can drop down, hips can drop down, legs can come more balanced, and then we can have systemic balance within the body. And if there is other misalignment within the spine, then we can go in, adjust it, and you can actually do well and hold long term versus needing to be adjusted 3 times a week for the rest of your life.
I was just going to ask you, like, how long term? I know it's individual probably, but.
Yeah, that is a question that is very difficult to answer because everyone is so different. And that's really just depends on how the person's body heals. So I typically say that it takes 90 days truly for the body to heal from an Atlas misalignment. And I say 90 days because that's about as long as it takes for muscles and ligaments to heal. Your muscles and ligaments heal about as fast as the hair on your head grows. So think about if you really sprain your ankle super bad, it's going to take about 3 months for that to heal. You know, an ACL tear or something like that, that can even take longer to heal. So I have developed a specific system that is really designed to create an alignment, then strengthen that alignment. And then what we do is we load the alignment. So we take them through a period of time where we're going in and we're realigning the segment, giving the body a couple days to integrate that and allowing the body to reshift and organize into its new place. It's really the easy part to get the Atlas realigned, but getting the body to hold it in the right place is the more challenging part. And that's because our muscles have what's called muscle memory, which is great if you're trying to learn how to ride a bike or play a sport. But if you've been in a misaligned state for a prolonged period of time, all of your muscular system is now remembering to hold you in this misaligned state. So when we go in and align the Atlas and get everything correct, now your body, we really have to do a tug and war with the soft tissue to get your body to remember to hold it where we want it to be. So we go through a period of time where we are doing that and creating an alignment, and then we give the body an opportunity through specific neurological and muscular retraining exercises to now create new pathways from those muscular tissues back up to the brain. And then we start to implement weights, bands, things like that to now load the alignment so that the patient can do well long term.
So you've explained a lot of the physical stress that a misaligned Atlas can cause to the body. And you mentioned mental stress. How does it affect us mentally and create stress in a mental capacity?
Yeah. So when we have all of this pressure on our brain, how can we expect it to function properly? And let's think about this. What do most people do all day long? They sit, right? And if they have a misalignment here, then they're having pressure on their spine all the time. And then they are not getting up and exercising, and they're not supplying their brain with any sort of nutrition. Actually, 80% of the nutrition to our brain is generated by movement of our spine. So if we have misalignment in the spine, the nutrition of the brain is just, it's not there, it's not happening. And so then we're putting demands on our brain that it just can't handle. And that's when our body starts to deteriorate. And that's when we really start to bring up that stress response. So we start to get tightness in the shoulders, cause them to roll forward, gives us pain, makes us anxious, things like that. Does that make sense?
Yes.
Not only that, but it's affecting that area of our brain that deals with all of our emotions. So sometimes I have patients that say, I just don't know what's wrong with me. They get stuck in this cycle of feeling so fatigued all the time and just feeling like they can't compute with life, and it makes them depressed. And suddenly we turn their lights back on, and now they can live their life fully again because their brain's functioning and it's supplied with nutrition.
it's amazing that we can walk around on this earth as long as we do, you know, with our body trying to compensate every second of every day, and us mistreating our bodies so badly the way we do, many of us. I have a question, because when we're taping this, it's late August 2020, and everyone's in lockdown, and I'm just curious, have you seen like a lot more like patients come through like having sat all day and just maybe at the computer in a not an ergonomically fit environment? Like, what have you seen?
It's becoming its own epidemic because people are now at home, they're working at home, and they don't have a proper ergonomic setup. And so they're putting these physical stresses and demands on their body with probably a misalignment that was already there. Now, if you're doing things right, you may not notice it as much as now you're doing things wrong. And now you're putting that emotional stress of quarantine and being in a non-ergonomical space. And all of a sudden, we're seeing all of these people come through with severe depression and pain that they just have never experienced before in their life. And so it's actually a great time for them to be able to go through this treatment, though, because they can go home, they can rest, they can really take care of their body and give it an opportunity to heal, so that when they do go back to work and they get their life going again, now they can actually handle everything that was coming their way.
So, how would you know? I mean, you've listed a lot of symptoms that could contribute to an Atlas misalignment, but how could you know if you have a problem with your Atlas?
Yeah, the best way to do that is to go look in the mirror. So go look at the mirror, sit up real tall, look at yourself, eyes level, and see if your head is tilted to one side or the other. You can also look at your shoulder height to see if one shoulder is higher than the other. Or you could lay down on the bed face up and have someone else look at your feet and see if one leg is shorter than the other. That's probably the easiest way for someone to tell on their own if their Atlas is out, besides from symptomology. The main symptoms that I see from Atlas misalignment are headache, brain fog, chronic fatigue. We see neck pain, mid-back pain, low back pain, and knee pain.
I know when I first came to see you, I can't remember what side, but I can't remember what side. It was this side. And I was off like 4 point something degrees.
Yep.
I've been walking around like this for 4 years.
Mm-hmm.
So, I mean, I know what the correction looks like because I've seen you, but can you describe like what that would look like if someone were to come to your office versus a traditional, what people think of it, they think of as a traditional chiropractic adjustment? You're different.
Yes, very different. We utilize an instrument called the Atlas Orthogonal Adjusting Instrument. So Dr. Roy Sweat back in the 70s actually developed his own table instrument. And so what it is it's an instrument-based chiropractic technique that the adjustment occurs in your own natural range of motion. There's no pop, there's no crack. It's actually a percussive wave. Similar, the way I describe it is a Newton's cradle, how people have those things that sit on their desk where they pull one ball and it hits the other, the transfer of energy. That's about as heavy of the adjustment as it is. It's about 6 PSI, which is the pressure that you could put on your eyelid. And really what we do is we take mathematics and physics and use it to our advantage. So through specific radiographs, we measure the misalignment of the Atlas bone down to the closest 1/100th of 1 degree. So in your case, Lynn, what we do is we take a picture of the Atlas. We say, okay, here's where the Atlas went. Here's where it needs to go. And this is the angle we have to take on it to bring it back. So we adjust on a Z and a Y coordinate plane, Z for the laterality, Y for the rotation. The patient is side lying on a very specific headpiece that supports the weight of the head, but allows the Atlas to be suspended in the air there. So what we're doing is we're removing the heavy part, and now we have access to this 2-ounce bone where you just don't need that much force to move it. So the correction happens really fast. It's really accurate. So laws of physics states you just don't need a lot of force then.
And I remember walking out of your office that first day. I was like, are you serious? Like,
most people don't realize that a adjustment has occurred until about 4 hours later. Sometimes it can be immediate. When we have a large rotational component of the Atlas, our major blood supply to our brain, or one of the major blood supplies to the brain, is the vertebral artery, and it runs directly through the Atlas, through 2 little holes in the Atlas. So when there's a rotational component, that blood supply gets really constricted. That's when you can see things like those headaches, because those are a vascular symptom. So after correction, sometimes people can get like a warm sensation into their body. And then you will experience a change into the way that you walk. So a change in the gait when the legs become more balanced. You might get muscular soreness from the muscles finding their new place. But all of that occurs very, very quickly, but also slowly at the same time. So about 4 hours later, patients might get sore. They might get very tired because now the body goes through a huge healing response. Because it has a systemic effect on the entire system, we're healing things that we didn't even know were an issue.
I remember going home and 3.5 hours later, I was like, I have got to go to sleep. And I do not nap, but I napped for like 3 hours. My body was just like, it's time. We're napping and we're just, it was. And then I do remember too, and I wonder if you can explain like the mechanism for this, but I remember going, I can take a deep breath, like fill my lungs, like my diaphragm was like 100% filling up. And it was like, I haven't felt that in a long time.
Sure. So the Atlas bone, you have to think of it kind of like the first link in your spinal chain. So if you were to take a link of chain and hold it against gravity and turn that top link, what are the other ones going to do below it? They're going to follow it, right? So you have to get that top link sitting correctly first for the other bones to fall back into place. Now, when those other bones fall back into place, all of the nerves that come out of them that go to your lungs, that go to your digestive system, now all the pressure comes off of them as well. And we can experience a sensation of fullness of breath, ease in digestion, things that we talk about are attached to what's called the autonomic system. So breathing, digestion, things like that, things that we don't think about. And that's why I say you get so tired because your body is healing things that you didn't even know were an issue and you didn't even know were affected. Really, we have something in every joint of our body that are called mechanoreceptors. And mechanoreceptors are a really big word for movement and posture. Now, everywhere else in the body, they're in pretty low quantity. So your latissimus dorsi muscle is one of the largest muscles in your back, connects into the shoulder and then all the way down into the mid-back. The latissimus dorsi muscle has 14 mechanoreceptors per gram of tissue. Now, there's a really tiny muscle in the upper part of your neck, and it's what connects your atlas to your head. It's called your superior oblique. That muscle has 246 mechanoreceptors per gram of tissue. So these receptors are sending messages to our brain about where we are in space and our movement and posture. So if we have distortion here with that signal going to the brain, that's why the entire body will distort itself, because the rest of the body is really like a slave to what's going on in the upper part of the neck. So that's why we can have such a crazy effect into different areas of the body.
So can you go a little more in depth about like what we consider typical chiropractic care and what you do? I see a chiropractor and I see the results of going to the chiropractor, and there's definitely been improvement because I had low back pain, neck pain. When they're adjusting, do they ever touch the atlas bone, or do you have to have that special adjustment?
Sure. There's manual ways to adjust the atlas bone, and there's also instrument ways to adjust the atlas bone. I choose to do an instrument adjustment because I really believe in maintaining the integrity of the muscles and ligaments. If you're under great specific chiropractic care, I love that. I think that all chiropractors are great as long as they're practicing true chiropractic and being specific with their adjustments. I just believe that when you take a ligament to tension and push it farther than it needs to go, that you can create micro traumas and micro tears within the tissue. And especially in such a sensitive area, that's why I choose to utilize an instrument that's very accurate and very low force.
And we talked a lot about thus far about this specific area, but you do make adjustments all along the spinal cord. Can you talk about that a little bit?
Sure. So I also do a secondary technique that's called Activator. It's also an instrument. It's a spring-loaded instrument. It has its own analysis system as well. And so once we get the Atlas put back in the right place, now we can really see if there's any other true misalignment in the spine after the body has had time to reorganize from the Atlas correction. And then we can go in and we can adjust other areas of the spine, because I'm not ignorant to the fact that you have an entire body, right? So with Activator adjustment, we can pretty much affect anything down from your ankles to your knees, adjust your hips, everything like that.
So what happens then after you get your correction?
Yeah, sure. So like we said, it takes about those 90 days for the body to heal. So I typically start people on a very conservative 90-day plan there, where, like I said, we're creating an alignment, we're strengthening alignment, and we're loading alignment. So I always tell my patients things that they can expect afterwards are tiredness, a warm sensation from the restoration of blood flow, a change into their gait, and then overall muscular soreness.
I'm curious, is this, I know a lot of people that go to you.
Yeah.
And we're all kind of like the same, we're athletic, you know, and, but are there certain age, this is for every age out there, or are there some people or populations that maybe wouldn't be good for this type of, I'm just curious.
There's definitely people that don't have a problem with their Atlas. And I am so happy to tell someone that they don't have an Atlas issue. And that's something we can tell really quickly. If their legs are balanced, they have no postural distortions, and they have no pressure in the upper part of their neck, then we don't really have an Atlas issue. And that's great. We can start them right on Activator protocol. But when someone has an Atlas issue, that's where we have to start, because we have to get the head sitting correctly first so that the shoulders can drop down, hips can drop down, legs become more balanced before we start looking at other places. But there's really not a right or wrong time to get started. I've adjusted everyone down into just a couple days old, all the way up until seeing them at 86 when I was the first time they ever got adjusted. When we look at the minor population, when we look at someone that's under like 16, 17 when they're still growing, we really don't take x-rays on them. And so we utilize just their palpation findings, their postural distortions to adjust them through that.
So it sounds like there's a lot of things that can actually move the Atlas into a position that it shouldn't be in. How common is it to find somebody who doesn't have a problem with their Atlas?
I would say it's about 5% of the population.
Wow.
Yeah, I mean, if we think back even to childbirth, there's C-section where they're pulling the baby out, vacuum, forceps delivery. We're so concerned about the baby's head after it comes out, but we forget about the actual physical traumas of birth that can happen. How many times do we fall down and hit our head when we're learning how to walk, riding our bike? I mean, I'm sure every kid has a story where they fell off the trampoline or wrecked their bike or something like that. And then we get into sports as kids. And then we get into life. How many times do we hit our head on the car door? And like I was talking about before, it's really a limitation of matter. So it can be a compounding effect of minor traumas over a period of time, that it's a bump here, a bump there, things like that, that really add up, that cause that bone to shift.
And then with stress, and if we carry our stress in our neck and our shoulders, even that, right?
Yep, absolutely. Well, think about what happens to your body when you're stressed. you close down just like this. And now your body is chasing your head. So you're chasing the weight of your head, because by demands, we have to have the weight under our head, because like we talked about, that mechanoreceptive input, it makes the body a slave to the head there. And so that can cause so much physical and mental distortion up into the brain.
So that you talk about your head moving forward,
Everybody
wandering around with their head down, looking at their technology, I would think that the number of people whose Atlas is out of position has increased as the technology has, maybe technology use has increased.
I would agree with that. I would definitely agree with that. It's something that we call text neck. And it's unfortunate that I will see 10-year-old kids that have no cervical curve left. And that's because they've been given an iPad to look down at all the time. We should always be looking up. You should always have your monitor raised up. You should always hold your cell phone up, even if you look like a dork doing it. It's for the health of your neck, because when we go like this, the cervical curve of our neck gets decreased, and that's when we start to see degeneration. And that's a really great point to bring up. So we have 7 bones that are in our neck that create our cervical spine. And our cervical spine creates a backward C shape, and our head sits on top of that backward C shape. And that cervical curve is there to help distribute the weight of our head and be the shock absorber of gravity coming down. Each one of those 7 bones takes a little piece of the weight. Now, when we go like this all the time and we're causing our cervical curve to straighten, what happens is when that cervical curve straightens out, we create a pressure point right here. That's the middle of the neck, typically like your C5, C6 area. And then those 2 bones start taking all the pressure that 7 should be doing. And that's when we see, 25-year-old kids that now have all of this early onset degeneration. Now they're having numbness and tingling into their arms and their hands, trouble with their breathing, because that's where the nerves go out to. And so what we have to do is take the pressure off of that segment. Degeneration is a progressive disease. Now, there's a lot of people out there that think that degeneration is just something that happens as you get older. And that's just not true. Degeneration happens because of unequal joint loading over a period of time. Now, there's something in the body that's called Wolff's Law. And it's a law within the body that states that the more pressure that we put on a bone, the more bone will develop there. That's why people with osteoporosis are prescribed weight-bearing exercises, is because that weight-bearing triggers the brain to stimulate sending what's called an osteoblastic, a bone-building cell, to that area of the body. And then it causes us to build bone there. Now, that's great if you have osteoporosis, but if you have a misalignment here or here, and you have a straightening of your curve, creating a pressure point that's telling your brain to send osteoblastic cells to that area all the time. When it lays down the bone there, it doesn't do it equally. That's when we create bone spurs and what we know as degenerative disc disease. So that whole process can be avoided if we can just load up the spine correctly the way that it was designed, take the pressure off those segments, and stop that process from continuing or starting in the first place.
Do you have a picture that you can show us of how you do the adjustment or what it looks like?
Yeah, absolutely. So this picture right here, this is a picture of a person about to get their Atlas adjustment. So as you can see, they are side lying and their head is on a very specific headpiece that's made out of rubber. Now, this headpiece allows the head to be supported and so that the Atlas is suspended in air. Then if you take your finger and you press in behind your ear and you can feel that sensitive area right here, that's right where your Atlas sits. So the stylus of the instrument is sitting right there. Now, this instrument was actually created out of necessity because it's really difficult to get to the Atlas manually because of how tucked up under the skull it is. So if you see, we have a bunch of different protractors here. The protractor on the top, that's where we measure the laterality, so the right to left component. That's what we would call our Z component on that graph. Now, this handle right here, what it does is it makes the mechanism come forwards and backwards. That's our Y component on the graph, or our rotational component. So the whole apparatus moves around so that we can put the person's, what we call vectors, that's their Z number and their Y number, so we can specifically and accurately target the atlas right where it is so that it easily goes back into place. I like to use the analogy of hitting a nail into a piece of wood. If you hit a nail at the right angle, it'll go in really easily. But if you try to hit a nail from every which way, you need a lot more force. So we've measured it out very accurately, and now that slides in like butter.
So does the patient feel when it's moved, or do they feel much of anything?
You barely feel it. You hear it more than you feel it. A lot of people will get a head rush when they sit back up from relieving all of that pressure, and then all of those other things that we talked about will occur after the adjustment.
Very cool. Well, thank you for sharing that.
Of course.
So, real quick for people out there, where can people find you? Where's your office? Are you on the internet? Where do you hang out?
Yes. So you can go to theatlascentre.com, TheAtlascentre.com. We're in Durham, North Carolina, where our office is located. We are on the corner of Shannon Road and Martin Luther King.
This has been so much fun, and you are just like a wealth of information. I'm trying to take notes as I'm talking to you, and I had forgotten, or maybe I didn't know, like, because I've experienced this with you, but it's really nice to get all the science behind, what you do and why, what's happening in the body. And yeah, I just love hearing all the science.
Yeah, it's truly an amazing procedure that I wish more people could experience.
And there's only 300 of you in the world.
Yes. So if you go on to atlasorthogonality.com, you can actually search by state and see where there's an Atlas orthogonal provider in your area. Yeah, thank you guys so much for having me.
You're welcome. You're very welcome. It's been a pleasure.
Thank you for sharing all of your wisdom with our viewers. It was very fascinating. I never knew such a small bone could have such a huge impact on the rest of the body.
Yep.
And the mind.
Yeah.
A lot of stress, physical and emotional stress within the body. So anyone experiencing any stress at all, which is most of us these days, it might be worthwhile to check out Dr. Allie or an Atlas orthogonal specialist near you.
Yeah. I very much encourage everyone to do so. Thank you guys so much for having me.
Thank you.
Thank you.